I would like to introduce Chris Deacon, the former director of New Jersey State Healthcare Benefits, and to join Cynthia Fisher, Kevin Morra, co-founder of Power to the Patient, and Cora Opsahl, who is with SEIU. They will tell us what the current impact of price transparency is and what the full potential to lower costs will be. Thank you very much.
Thank you. Clicker. Oh, how about if we play the video at the end, and we'll go to the slides. Thank you. This is such an incredible team because they're going to tell you about how we're winning, and I just love to win. I love to win for the, we want to win for the people because look what's happened. I mean, this was spoken of last night. We're at $4.5 trillion and ongoing for what the spend is in healthcare. That red line is our life expectancy. Yeah, that's our life expectancy on decline, and the blue line is the increased costs, and the little dip was during COVID when nobody was going to the hospital. Look at that. Okay, the United States is that in red, and we pay more for the worst quality of care compared to every other developed nation. Now think about that. We talked a lot about the unions and the workers, and last night about manufacturing, the need to bring more manufacturing back into this country and solar panels. How do we compete with all those developed nations as workers if we're paying that much more out of workers' paychecks for health care? We have to bring it back on par. And guess who's using our system from the 60s? Singapore. They're using the U.S. system of healthcare from the 60s. And here's where we see over time, the premium costs have gone up with inflation, but not workers' wages. Workers' wages have been suppressed. And Cora, I'm going to go back. Cora, could you please share with us how the unions are leading the way and what price transparency means to workers' wages ongoing?
Good afternoon. My name is Cora Opsahl. I'm the director of the 32BJ Health Fund. So we provide the benefits for the SEIU 32BJ union. It's 217,000 covered lives, mostly based in the New York City tri-state area, but up and down the eastern seaboard. And it's the largest property service union in the country. So it's your residential and commercial real estate workers, security workers, school workers, and airport workers. And it's a growing union. So I know yesterday there was a lot of talk about the growth of the union. And 32BJ is a growing union, and as the fund, it's my responsibility to provide benefits to these members. And our members have premium-free benefits, 100% paid for by the employers. But it's because of the work of the health fund that we're able to continue to offer this premium-free benefits. As you mentioned, Cynthia, the thing is, right now, we've done the math. In the last 10 years, healthcare as a percentage of total compensation has gone from 17% to 37% in the last 10 years. At that same time period, wages have gone up 54%, but healthcare costs have gone up 230%. It's untenable and unsustainable. And then when we think about that, what does that really mean to the workers? If healthcare costs had gone up at just the rate of inflation, the 32BJ union members would have had an annual $5,000 more in their check every year. That's food on your table, that's rent that you can pay, it's a vacation with your kids. And so when we think about healthcare costs and we think about wages and how does this work, it's like, I think unions are the tip of the spear because they acutely understand the concept of like total compensation. And everyone in here is an employer, and everyone in here understands that healthcare is a piece of that, but I think unions are uniquely situated to be able to do that.
Kevin, you've spent some time because the unions are actually getting together, right, on this whole cause. And you've been involved with, we'll hopefully be able to see some of the production work that you've done with Power to the Patients. But could you talk a little bit about what happens in New York, having the union seeing the good that SEIU 32BJ has done to put nearly $100 million back into their own enterprise plan, which is amazing, and how New York's looking at it from other unions' perspective.
Absolutely. Thank you. It's a pleasure to be here amongst like-minded individuals. Power of the Patient started because of a humanitarian issue, as Chuck D from Public Enemy calls it, an American humanitarian issue, which is not something we often hear, right? Humanitarian issues are for overseas, oftentimes in developing countries. But when you have a healthcare system, the basic infrastructure of a developed country, when you have a healthcare system that is almost unreasonable or irrational to enter because there's a complete void of prices that eventually will have an incredible impact on your financial health, right? So you enter a hospital, and as Cynthia brought up earlier, you're forced to sign this personal guarantee to say, we are going to implement a number of procedures and services, and eventually you're going to get a bill in the mail, and you're guaranteeing right now that you will pay for that bill. However, you don't get to see what any of the prices of these procedures are, or if you should be across town or next door, or ultimately the opportunity to price check to make sure that your bill is even accurate. So this is a humanitarian issue. This is not a partisan issue. This affects everybody. More marginalized communities in New York City. If you stand on any street corner in the Bronx, you will watch people walk down the street with a limp or in a wheelchair for decades that don't go and seek care or help or remedy for what ails them. Why? Because healthcare is not for them. They can't afford it. They don't want to be in a critical moment where they decide, do I pay my rent or do I pay this medical bill? Do I try and get out of this area or into a bigger apartment or send our first generation off to college, or do we pay this medical bill? And that includes preventative care. Why go and get a colonoscopy if the outcome could mean personal bankruptcy, right? So we're very much boots on the ground. We very much have found influential people to join us. Shepard Fairey, one of, probably the top 1 or 2 street artists in the planet. You may know him from your own activism work. He's always creating new artwork for civil rights and human rights. He created the Barack Obama Hope poster, which is now in the Smithsonian. He created the artwork for us, for price transparency and power to the patients. And we have now painted that artwork as a mural in 47 communities around the country. And that includes Nashville and Los Angeles and Seattle and Dallas and New York City. And tomorrow morning, a local artist named Mary Lacey paints this artwork as a mural right here in Burlington on the sides of, all 3 sides of the Barrio Cafe, which is on North Winooski Avenue. And I want to thank the local property owners, Chris and Sarah from Shoeless Management, for giving us that canvas so that we can connect Burlington to the rest of the communities around the country that are now understanding what it means when we don't have price transparency in healthcare. And it's been an honor to stand and to be boots on the ground with unions. There's 16 in New York City that together we've created a coalition, but certainly 32BJ is one of those. And the last thing I'll say before I hand this back off is, upcoming we have this presidential election, and certainly in this room, I think we keep hearing that it's election of decency or indecency, right? That's kind of the option. Well, healthcare price transparency needs to be discussed if we are to be decent, right? Because the number one cause for personal bankruptcy in this country, it's not junk fees, right? It's not going to Hertz and then hitting you with the $4.37 upcharge that you didn't know coming and they can't justify it to you. It's not paying too much for a Taylor Swift ticket, right? It's the lack of price transparency in healthcare, and medical debt is the number one, and it's not even close, the number one reason for personal bankruptcy in the United States, and it's not being adequately addressed right now. And that is indecent. Because what's happened here is, the last thing is healthcare provides non-discretionary services, right? Necessary procedures and services so that we can have proper health or so we can survive. And what's happening now, people are making a decision, a deliberate decision, to not seek medical care, to not take these non-discretionary procedures. And when non-discretionary becomes discretionary, we all have a real infrastructural issue in this country. Thank you.
Thanks, Kevin. Chris, thank you. I think one of the statistics is it's over 54% of people deny themselves care for fear of financial ruin, and they put off care. So we need to move it to the front of the curve, which was said earlier today with primary care and going and getting the care you need before you need it. Chris, you've worked with unions like SEIU 32BJ. Even as New York City is identified, they pay, $10 billion a year in health care, and they've identified if they did what SEIU has done, they could save $2 billion a year. You saw that figure up on the screen that we're paying $4.5 trillion. It's been noted in so many journals, peer-reviewed, that 25% of that's just pure administrative waste. We looked at all those administrators and managers. You cut it out by having people not tolerate being overcharged and having the medical field compete just like every other market on price. What do prices bring? People want to know what they're going to get for that price. So then you get competition on quality and outcomes. But if we could look at saving that 25% a year, that's $1 trillion. You don't need to tax anyone. We just all need to become our own patient advocates in every employer and union to drive these costs down by $1 trillion a year and put it back into the pockets of the American people. That is a goal we can achieve. And Chris, maybe you want to tell us more about the employers that are.
Yeah, sure. So quickly, I'm a lawyer by training, but I no longer practice. I pivoted to healthcare and public service a few years ago. As Cynthia mentioned, I ran the state of New Jersey's public sector health benefits program. We covered about 820,000 public sector lives. So your teachers, public sector workers, professors, and our uniformed professionals. And now, as I work around the country with leaders like 32BJ, the bricklayers, the mass laborers, what we're seeing is employers have woken up to prices that they see as completely unjustifiable. In looking at prices and hospital prices in particular across markets, like Cynthia said, when you're seeing that you're paying really good money for access to a network, right? And that network price is $2,000 more than if I had just paid cash, something's wrong. Something's broken. I mean, I had just share a quick anecdote that demonstrates that. I went to an orthopedic urgent care. They couldn't find my insurance because I'm not sure why. I said, I'll just cash pay. And after some cajoling, I got them to let me do that. When they reprocessed my claim under the state health benefits program a month later, I paid cash, $300. When they reprocessed my claim, I got an explanation of benefits in the mail for $2,100. The taxpayers of New Jersey and myself paid a premium to get access to a network that overpaid that bill by over $1,000. Something's wrong and something's broken. But employers are waking up to that, and they're demanding information. They're not only demanding that hospitals post their prices and that insurance companies are more transparent, they want access to their data. And this is where we're coming up against a really hard brick wall. 32BJ is fairly revolutionary in that regard. Employers are saying, hey, Anthem, hey, Cigna, hey, United Healthcare, I want to see what I'm spending. You know, the state of New Jersey, we're cutting a check for $25 million a day to Blue Cross Blue Shield for our health benefits, and we weren't seeing what we were paying for. To use the credit card analogy, we were giving them a credit card. They were racking up, you know, paying the $2,100 to the urgent care and presenting us with a bill every day and preventing us from seeing what we were paying for. And there's good reason for that. You know, when we talk about, you know, I think it's closer to a third or more of administrative waste, that's what we're finding. And that's what these employers are finding. And they're taking their insurance carriers to court. The unions are leading the way on this, as Cora mentioned. We have a huge case in Connecticut with bricklayers, sheet metal workers, a whole class of unions. We had the Massachusetts laborers file a suit in Massachusetts, and we have other employers following suit to demand information and accountability. And it's huge, it's important. 160 million Americans get their health coverage from their employer. So it is a huge issue. And I just want to, I think it's 54% of folks that are, scared to go seek care. It's important to know that most of them have insurance. We're talking about underinsurance, right? When you have a high deductible health plan or a consumer-driven plan that, you know, you're going to have to spend $4,000 out of pocket before you even get your first dollar of coverage, you don't go to the doctor. You don't get that MRI. You don't get that lump checked out, and that's wrong.
So, you know, Cora, you've been able to design a plan. Maybe you can talk a little bit about your plan design that ended up rewarding your employees and preventing those types of expenditures.
Happy to. So, you know, I think one of the things to think about is we've been really revolutionary. We've had our claims data for now like almost 20 years. Fought really, really hard to get it. But what I know now is way more than I knew 5 years ago or 15 years ago. And it's actually, I'm going to know more in a year. And that's in part because we've had to fight, like claw that information tooth and nail, data feed by data feed, to get the receipt for what we've paid for. But in doing so, for the last few years, we've been looking at all of the claims data, reverse engineering, as Cynthia put it, and we were able to see that we were paying wildly different prices for the same exact thing. At the most highest priced hospital in New York City is New York Presbyterian, and we were paying $10,000 for a colonoscopy there. Another high-quality academic medical center, Mount Sinai, I was paying $4,000 for a colonoscopy. There's no way a colonoscopy is worth 2.5 times more at a hospital literally across the park. And so as we started to do this, we tiered our networks. We did that in 2018. And then finally in 2022, we ended up removing New York Presbyterian Hospital from our network. And that wasn't an easy choice because it impacted 25,000 of our members. But let me be clear, we created a win-win situation and our members understood. The fund partnered with the union, and they went to the streets, and through public action and public conversation, most of our union members can talk to you about why we made these benefit decisions. And it's to have the premium-free health care, to have the ability to go to certain hospitals to have a baby for no copay. And so any of you who have had kids in this room, you probably paid more than $0 to have your babies. And so we did this, but the thing I always like to say is that you can't just make changes that limit access without creating win-win solutions. So as Cynthia mentioned, the fund has been able to save $35 million a year, and now we're on year 3. This is how she gets to 100, and that's a big number. It always makes me nervous. But during the most recent contract negotiations between the employers and the union, about 10 years ago, they realized if we fought together against healthcare prices and hospital prices in particular, we wouldn't have to fight over it at the bargaining table. I can see the union organizers nodding in the room. And so they've been able to create win-win solutions. So the union was able to give the largest wage increase in contract history, a $3,000 bonus, and a pension increase.
Oh, that's great.
Meanwhile, on the employer side, because again, you have to make sure this is win-win, and I, as a fund, I report to both the employers and the union, so they both have to stay happy with me. The employers got a 2-month premium holiday, which essentially netted their premium increases to 0, and the premiums will not go up more than 3% for 2024, 25, 26, and 27. So I don't know, most of you in the audience. I don't think most folks will know what their premiums look like in 2027, but we do. But that also means it's on us as the health fund to know how much income is coming in for the next 4 years, that it will be our responsibility to look at this data, have access to more and more data, to be able to see, okay, if this is what I'm paying, what is the cash price? What is other plans within the same insurance carrier paying? What could I get if I had other insurance carriers? And that is why it's so important to have the transparency, because you can't fix what you can't see.
That's exactly right. And look, a lot in Texas, and the states are actually getting on the bandwagon. Mm-hmm. And we didn't even talk about that, but in Texas now, you're protected. If that cash price is lower than your insured rate, they have to count it and reimburse you in the plan, and also count it toward a deductible. And so, I just know of one patient that had an ACL brace after an ACL repair and said, I want to pay cash for that. Don't charge me. I'm not going to go down the hall of the brace shop. What was the price for the plan and for him with the brace shop? $1,500. He and the doctor went online and looked up on Amazon what the same exact model number was for cash. $150. So think, if you're a family and you've got 5 athletic kids and how many ACL repairs you're going to end up doing, or have braces, and all of these things are so impactful to what that means. And Chris, I'd like to show a slide that is pretty amazing.
Yeah.
So Chris is a lawyer, and as she mentioned, there are lawsuits now. Kraft Heinz just sued Aetna because they started to get frustrated that in their audit they only got a handful of billing and claims data. The plan refused to give them all. And when they looked at them, they found they were being way overcharged. They sued Aetna for $1.2 billion. Aramark, hundreds of thousands of food worker employees. I know we've got a food worker here. Hundreds of thousands. They just sued their health insurance carrier for over $1 billion. Ford Motor sued Blue Cross for $1 billion. There's a big whistleblower suit in Missouri right now for all the commercial plans being charged by Blue Cross for an administrative fee to give back to the hospitals their tax amount. And that was put into the federal government. Department of Labor just sued Blue Cross in Missouri. So, Chris, tell us about, from the lawsuits, this slide just came out, that top line. This is a claim at the very top. And Chris can tell us what's happening here and the great reveal from the lawsuits that we're just starting to see in the public information.
Yeah, so pardon me, but I get really excited when I look at both data and lawsuit stuff. So what you see here at the top, as Cynthia said, this is just a claim file, and most employers aren't getting this today. This was just unsealed in a lawsuit. So you have on the far left the charged amount. This is what the provider says. This is the sticker price.
And Chris, this is like an inpatient anorexic or
a substance use disorder, or it's some inpatient behavioral health claim, a very long-term claim, so it's a very large claim. But these types of shenanigans largely happen. They happen a lot in the behavioral health space because a lot of times carriers don't want to pay for behavioral health. So we have a charged amount, and then we have an allowed amount. That's the most that the hospital or provider could ever get paid. And then we have the paid amount. This is what the provider actually received, $875,000. Between the charged amount and the sum billed, they were able to inflate the total bill to a much larger number, and when I say they, I'm talking about Cigna, in order to get to $11 million because the savings fee, in this case, is from MultiPlan, and I know Senator Sanders is very familiar with MultiPlan. They're going to base their savings off of the delta between the sum billed and the paid amount. So if you see here, Cigna keeps $2.5 million. The provider only receives the provider receives $875,000, and this little known vendor that most employers haven't even heard about because it's not disclosed to them when they pay their claims, MultiPlan walks away with $677,000. The employer is presented with a claim and a demand for payment in the amount of $4 million. And they're not told what's happening in the red and orange here. Now, this kind of claim happens in all different amounts across all different plans every day, and employers are losing a ton of money and they don't know it. But I think the most important visual here is the red. That's not healthcare. That's fact. That's, in Mr. Sanders' words, the religion of greed. That's, if I can get more, I'm going to get more. I'm going to inflate my bill, and I'm going to claim $2.5 million of that.
And to the employer, isn't it that, Cora, that the insurance carrier like Cigna says, we're going to share the savings with you. We'll just take a percentage, and it's either 30 to 50% of what we save off of that funny number that's as high as it can possibly be, because the bigger the top line is, the more money the insurance carriers make.
And likely all that the employer would see is either that they paid $4 million, or if they ask the carrier, well, you know, that's a rather large claim, what they're going to hear back is, well, it's not $11 million. We saved you a boatload of money. And that is the response that they will give. And that is, you know, representative of the waste and the bloat in healthcare. I mean, we have $1.4 trillion of that total $4.6 trillion in spend. Almost $1.4 trillion
a year for the 7 largest carriers. 7. And if you think of that, and thank you, Chris, I mean, this is the first time, because this lawsuit and the data just got into the public domain, this is the first place and the first time this has been revealed. And it's shocking that we would see Cigna pay over 3 times for not giving health care, just being a middle player. And so when people in those focus groups that, you know, Kevin, we've done with the patients say, thank goodness I have health insurance. You know, think about the big business here, right? No. We need to start saying, thank goodness I have access to prices. Thank goodness Senator Sanders has been leading the way, too, to say in legislation proposed, we need access to actual prices from the hospitals, the insurers, and we need to see every single charge of those middle players. And on top of it, this big movement is to get access to the what do the employers and unions need? Access to what's in Section 7 of that bill is
access to claims data. I always say it's like you wouldn't go to a restaurant or go shopping and not ask for your receipt. But every day you go to healthcare and employers are not getting the receipts. And I always think it's really important because we talk about co-pays and co-insurance and high deductible health plans, and that is so important because it is stopping members, individuals from getting care. But that rest of that bill that people don't see, that's every employer in this room is paying for that. And so you need to know what you're paying for so we can stop overpaying for everything.
And I think, we talk about the numbers and that claim is shocking, and I could show you 20 more from that lawsuit. But we have to remember that behind that claim is a claimant, otherwise known as a patient, and a person. And that individual will get saddled, and their family will get saddled with a bill that is some percentage of that massive number. And that's somebody that says, okay, I'm going to go get help. But how many people who have substance use disorder, who suffer from alcoholism, who have an eating disorder, are suicidal, they say, you know what, I don't want to be a burden to my family. I don't want my parents to have to declare personal bankruptcy. I am not going to seek help. And we lose people as a result of that.
Kevin, anything you want to also add here?
It's an example that reminds me of a really great quote said in one of the State of the Unions by President Biden. He said, capitalism without competition is not capitalism, it's exploitation, right? And here's an economic fact. Without prices, you cannot have competition. Therefore, capitalism without prices is exploitation, and that's exactly what happens.
I think we're going to see, like we see it in LASIK surgery, or you see it in plastic surgery, you see it in any place where there's a cash market, is the prices have come way down. And they're really affordable. Even cataract surgery, we're seeing that happening as well. And the reality, too, is what is the percentage compared to Medicare? And I was just in another meeting where the claims were looked at and compared to Medicare prices. And sometimes employers have been charged for labs and imaging 600% more, 800% more, and an erroneous claim at 4,000% more than Medicare. And the only way you can refuse to be overcharged is to know what you're paying. And believe it or not, the big business of insurance carriers has made these employers handcuffed and unions handcuffed by making them sign contracts of gag orders, which is against the law now. And also that they couldn't reveal prices to their members. And the second thing is anti-audit provisions. And big accounting doesn't audit our health plans when Delta Airlines might spend over $1 billion. Why is it they don't audit the health plan? Because they choose not to. Because they consult to 20% of our gross domestic product being spent in healthcare. So if we want to compete as a country, I believe very firmly we can bring it down and get that $1 million back into all of our lives and our pockets and our wages. And it's going to take all of us to be democracy every day. And demand to know prices. Don't pay the bill till you get the prices. And if you can find a lower price, work with your employers. At that, I just want to say, anybody else have a final comment?
I would just like to say a bill passed in the House in December for price transparency, and it was a really good bill. The problem is, within that bill, there was a loophole that allowed, instead of real prices, estimates, right? And as we say at Power to the Patients, estimates are bullshit, because there's no correlation between the estimate you get and the end charge, and there's no accountability for the hospital that gave you a low estimate, correct? There's a bill now in the Senate, thank you, Senator Sanders, and bipartisan Senator Braun out of Indiana, and this is the bill that we are 1,000,000% behind. The last thing I'll say...
Because it's actual prices.
Actual
prices.
Actual
access to the billing and claims data.
That's right. It is no doubt tough being a politician. I think it's much tougher being a humanitarian, especially in 2024. But being a humanitarian that's also a politician feels like it would be impossible. And so I want to thank Senator Sanders and his family and everybody here that supports his movement for human beings in this country. And thank you for being here. It's been a real privilege for me.